There is a plant growing through the cracks of your sidewalk right now that stops bleeding on contact. Not slows it, stops it. It fights 9 species of bacteria. It regenerates damaged skin cells. It draws venom from insect stings. Every part of it is edible. It is high in calcium, vitamin A, vitamin C, and vitamin K. It has been used as a wound healer on every inhabited continent for over 2,000 years. The Greek physician Dioscorides prescribed it in the 1st century. Persian scholars documented it in the canon of medicine. Scandinavians named it groblad, which translates directly to healing leaves. When the Puritans crossed the Atlantic, they carried it with them. It spread so aggressively around European settlements that Native Americans gave it a name that still haunts the historical record. They called it white man's footprint. It appeared everywhere the colonizers walked. And despite that name, despite what it represented, indigenous nations across North America immediately adopted it as medicine, because they recognized something the modern world has forgotten. This plant heals what pharmacies' shelves charge billions to treat. In a clinical trial on human patients, it achieved complete wound healing in 64% of cases. The hospital standard achieved 20%. Today, the global wound care industry is worth $24 billion. This plant grows for free between the cracks of your driveway. This is the story of Plantago major, the broadleaf plantain. The name itself tells you everything the modern world refuses to acknowledge. Plantago comes from the Latin planta, meaning sole of the foot. Not because the plant looks like a foot, but because it grows wherever feet tread. It thrives in compacted soil, damaged ground, trampled earth. It does not need rich garden beds or careful watering. It needs exactly the conditions humans create by walking, building, and paving. It follows civilization, and it always has. Pollen records from Scandinavia confirm that Plantago major arrived alongside the first primitive cultivated fields in the Stone Age, nearly 4,000 years ago. Wherever humans settled, the plant appeared. The Greek physician Dioscorides described its wound-healing properties into materia medica in the 1st century AD. Roman physicians applied it to battlefield injuries. Persian scholars in the 10th century, including Avicenna in his canon of medicine, prescribed it in dozens of formulations, from poultices and syrups to decoctions and liniments, to treat wounds, fevers, bleeding, and inflammation. In Scandinavia, the plant's common name groblad, healing leaves, was not metaphor. You see the plant, you pick the leaf, you place it on the wound. That was the entirety of the prescription for centuries, and it worked. When European colonists arrived in North America in the early 1600s, Plantago major came with them, likely carried both intentionally and in the mud on their boots and the seams of their grain sacks. The plant established itself in the disturbed soil surrounding every settlement, every road, every cleared field. Native Americans watched it spread. They named it white man's footprint because it appeared in the ecological wreckage left behind by colonization. Indigenous nations did not reject the plant. They adopted it immediately. Across North America, tribes used the crushed leaves as poultices for bruises, burns, and headaches. They applied them to draw venom from snake bites and pus from infections. They used it to treat kidney disease, swelling, and skin conditions. Some tribes called it chokeweed because plantain-thickened water could draw a small bone from the throat so it could be coughed up or swallowed. The plant's presence in Indigenous life became so significant that Henry Wadsworth Longfellow titled an entire chapter of the Song of Hiawatha after it. Chapter 21 is called White Man's Foot. The Metis people of Canada incorporated it into their traditional wound care practices alongside white spruce and yarrow, 3 plants working together as a complete field medicine system. A plant that tracked the destruction of their lands became one of their most valued medicines because the biology was undeniable. That biology has now been confirmed in laboratories. Plantago major contains a compound called aucubin, an iridoid glycoside that functions as a natural antimicrobial agent. When the leaf is crushed or chewed, aucubin is hydrolyzed into aucubigenin, which creates a dialdehyde that denatures bacterial proteins on contact. It has demonstrated activity against 9 species of bacteria, including Staphylococcus aureus and E. coli. The plant also contains allantoin, a compound that stimulates fibroblast proliferation and keratinocyte migration, the two cellular processes essential for tissue regeneration. Allantoin is the same active ingredient found in high-end pharmaceutical skin repair creams that sell for $30 to $50 a tube. In the plantain leaf, it is free. The third compound is mucilage, a polysaccharide that coats damaged tissue on contact, reducing pain and creating a protective barrier against further infection. Then there are the tannins, which draw tissue together and constrict blood vessels, explaining why the leaf stops bleeding almost immediately when applied. Add ursolic acid and oleanolic acid for anti-inflammatory action, plantamagicide for additional antibacterial defense, and flavonoids including bicolane and hispidolin that inhibit the release of prostaglandins and histamine. This is not one compound doing one thing. This is a coordinated chemical response across multiple pathways, packed inside a single leaf that you can pick from a crack in the pavement. While most antibiotics from a pharmacy attack bacteria through a single mechanism, which is exactly why bacteria develop resistance, the plantain leaf deploys multiple antimicrobial agents simultaneously through different pathways. Aucubin denatures proteins. Plantamagicide disrupts bacterial cell walls. The caffeic acid derivatives, including chlorogenic acid, demonstrate antiviral activity against herpes and adenovirus. The plant does not fight infection with a single weapon. It fights with an arsenal that bacteria have not evolved to resist in over 2,000 years of documented human use. The clinical evidence is no longer theoretical. In 2022, researchers at Shiraz University of Medical Sciences conducted a case control study on patients with second-degree burn wounds. One group received a 10% Plantago major ointment. The control group received silver sulfadiazine, the global standard for hospital burn treatment. By day 7, no wound infections were detected in either group. The plantain extract matched the pharmaceutical standard in antiseptic performance on human burn patients in a hospital setting. A separate clinical trial published in the International Journal of Lower Extremity Wounds tested a 10% Plantago major gel on patients with diabetic foot ulcers and pressure ulcers. After 2 weeks, the plantain group showed an 87% reduction in wound size. The control group showed 53%. Complete wound healing was achieved in 64% of the plantain patients. In the control group, that number was 20%, not 64 versus 60, 64 versus 20. In an animal model studying diabetic wound healing, Aucubin gel at 40 micrograms achieved 100% wound closure in 11.7 days. The control group reached only 83% closure in 24.4 days. Germany's Commission E, the equivalent of the FDA for herbal medicine, has officially approved Plantago for the treatment of throat and skin inflammation. This is not folk wisdom waiting to be validated. It has been validated. The question is, why have you never heard about it? The global wound care market generated $24 billion in 2025. The United States accounts for nearly $8 billion of that. The traditional wound care segment alone, bandages, ointments, topical antibiotics, first aid kits, is worth $7.4 billion. Johnson & Johnson, 3M, Smith & Nephew and Convatec dominate this space. Their products line the shelves of every pharmacy, every grocery store, every gas station in America. Neosporin, Band-Aid, Polysporin. These are billion-dollar brands built on the premise that you cannot treat a wound without buying something manufactured in a factory. Meanwhile, a plant that matches hospital-grade burn treatments in clinical trials, that achieves 3 times the complete healing rate of standard care for chronic ulcers, that contains the same cell-regenerating compounds sold in premium skin creams, grows uninvited in your lawn and gets sprayed with the same herbicides developed in military weapons laboratories. It is classified as a weed. It is mowed, poisoned and ignored. Its fibers are strong enough to be used as sutures, fishing line and braided cord in survival situations. Pull a mature leaf apart slowly, and you will see the tough, pliable strands that run the length of every vein. These fibers have been twisted into cord by wilderness practitioners for centuries. Its leaves are edible, nutritious, and available 12 months of the year in most of the United States. And it costs nothing. If you've been watching this channel, you already know how this pattern works. Ancient knowledge validated by science, erased by industry, growing in plain sight. If you are new here, now is the time to subscribe. because what comes next could replace half the first aid kit in your bathroom cabinet. Here is how you use it, starting today. First, identification. Plantago major is one of the most recognizable plants in North America. Look for a low rosette of broad, oval leaves growing flat against the ground, each one 5 to 20 centimeters long with 5 to 9 prominent parallel veins running from base to tip. The veins are the key identifier. No other common lawn plant has veins that run lengthwise like this. From the center of the rosette, a thin flower stalk rises, bearing a dense spike of tiny greenish-brown flowers. You have stepped on this plant 1,000 times. It grows in lawns, sidewalk cracks, compacted paths, parking lots, roadsides, and garden edges. It thrives where other plants fail because it was designed to colonize exactly the ground that humans disturb. For immediate wound treatment, this is the fastest plant medicine you will ever use. Pick a clean leaf from an area free of herbicide or pesticide exposure. Chew it for 15 to 20 seconds until it forms a wet, pulpy mass. You will taste a mild, slightly vegetal bitterness and feel the mucilage thickening in your mouth. Apply this spit poultice directly to a cut, scrape, insect sting, or minor burn. Press it firmly against the skin and hold it there. The mucilage will coat the wound and reduce pain within seconds. The tannins will slow or stop bleeding. The aucubin will begin antimicrobial action on contact. If you have ever been stung by a bee or wasp in the field, a chewed plantain leaf applied to the sting site draws out venom and reduces swelling faster than anything in a first aid kit. Hikers, hunters, and wilderness guides have carried this knowledge for generations. This is not a substitute for emergency medical care on serious injuries, but for the everyday cuts, stings, blisters, and scrapes that send people reaching for tubes and packets. This plant does the same job immediately for free. You do not need to dry it. You do not need to process it. You chew it and apply it. That is the entire technology. For longer-term use, make a plantain salve. Collect a generous handful of clean leaves. Wash and dry them thoroughly to remove all moisture, which prevents mold. Chop the dried leaves and place them in a jar covered with olive oil or coconut oil. Let the jar sit in a warm place for 4 to 6 weeks, shaking it every few days. Strain the oil through cheesecloth, then gently heat it with beeswax, about 1 ounce of beeswax per cup of infused oil until the wax melts. Pour into small tins or jars and let it cool. What you have is a field-grade wound salve that you can carry in a backpack, a glove box, a kitchen drawer. It treats cuts, burns, blisters, rashes, cracked skin, and insect bites. It lasts for months, it costs almost nothing to make, and you can teach your children to make it in an afternoon. The leaves are also edible. Young spring leaves are the most tender and can be added raw to salads, where they taste mild and slightly earthy with a faint bitterness similar to spinach. Older leaves become tougher, but are excellent sautéed with garlic and oil, or added to soups and stews, where they soften and release their nutrients into the broth. The seeds contain psyllium-type fibre, the same category of fibre used in Metamucil, and have been used for centuries as a digestive aid. A simple tea brewed from dried leaves has been used traditionally to soothe sore throats, calm coughs, and support respiratory health. One plant that heals your skin, feeds your body, calms your gut, and clears your throat. Growing everywhere, costing nothing. Now picture this. It is 5 years from now, your bathroom cabinet is half empty, the neosporin is gone, the hydrocortisone cream is gone, the triple antibiotic ointment is gone. In their place, there is a small tin of salve you made yourself from a plant that grows in your yard. You made it once, in an afternoon, and it has lasted you months. You carry a second tin in your glove box. There is a third in your hiking pack. Your child falls off a bicycle and scrapes a knee. You do not reach for a plastic packet, you reach for a leaf. You show them how to chew it, how to press it against the skin, how to watch the bleeding stop. They do not cry. They are fascinated. They learn that medicine is not something you buy from a corporation. It is something that grows beneath your feet. It followed their ancestors across oceans. It survived every attempt to poison it out of existence. Their friends come over and ask what that plant is with the weird veins. Your child tells them it is called Plantago, from the Latin word for sole of the foot. They tell them it has been healing people for 4,000 years. They tell them it followed humans across every continent on Earth. They tell them it is not a weed, it never was. If you want to go deeper into the remedies we've been uncovering, head to our website to grab our free ebook on lost plant remedies you can start using today. Thanks for watching, click here to check out another video, and make sure to hit subscribe.